Welcome to the Enluxtra Self-Adaptive Wound Dressing in Service. Enluxtra is the first dressing of self-adaptive class. It is designed to reversibly change its function according to the feedback it gets from the wound, which makes it truly an any wound dressing. But what does self-adaptive mean exactly? It means able to sense the changing needs of a wound and functionally adapt to them. For example, let's take a look at a wound. If a wound is dry, Enluxtra's function would be hydration. However, when the wound environment starts changing and the wound unexpectedly starts exuding, the dressing at this area and this area only senses the change and switches its function from hydration to absorption, while all other areas continue to hydrate the dry parts of the wound. And if the wound stops exuding, the function of the Enluxtra would revert back to hydration. Self-adaptive dressing is designed to dynamically balance the evolving moist wound environment, providing hydration or absorption depending on the instantaneous needs of wound and peri-wound skin. Fluid from exuding areas is absorbed and locked in. Dry areas of the wound stay properly hydrated. Enluxtra possesses unprecedented absorptive capacity and fluid lock-in ability without drying the wound. The absorbed exudate becomes tightly locked in the dressing and stays there even under high pressure, body weight, or under compression wrap. On highly exuding wounds, Enluxtra can be left for 5 to 7 days. On moderate, low, and dry wounds, up to 7 to 10 days. Enluxtra protects the healthy surrounding skin. Dressing removal is non-traumatic and painless, as the dressing does not adhere to the wound. Removal can be accomplished in one piece with no need for saline or solution. Self-adaptive dressing greatly reduces pain and odor. Because Enluxtra self-adaptive dressing creates an optimal moist environment at all parts of the wound, it helps eliminate the risk of desiccation. Enluxtra does not support bacterial growth in the wound or inside itself. It offers drug-free bioburden reduction due to its unique lock-in function. Dressing holds absorbed exudate with its harmful components and bacteria away from the wound, as well as depriving the bacteria from water, thus impeding bacteria multiplication. Enluxtra does not need secondary film dressing. Enluxtra has embedded microbial and fluid strike-through barrier film, which is also breathable. Self-adaptive dressing works for all wounds including acute wounds, lacerations, graft wounds, donor sites, trauma wounds, post-operative surgical wounds, superficial and partial thickness wounds, burns, and chronic wounds, pressure ulcers, venous ulcers, arterial ulcers, diabetic ulcers, leg ulcers. The Enluxtra self-adaptive dressings are available in 6" by 6", 4" by 4", and 2" by 2" sizes. Enluxtra dressings may be efficiently used as an alternative to vacuum-assisted drainage management, VAC, for wound drainage management. Unlike vacuum-assisted drainage management, Enluxtra dressings are applicable for wounds with slough and do not cause skin maceration. In comparison with VAC, Enluxtra provides dramatic simplification and cost reduction. With Enluxtra, the moist wound healing standard of care is automatically ensured. The dressing selection process is finally guesswork-free. Enluxtra works for any wound. It absorbs and completely locks exudate, prevents maceration, hydrates dry areas, reduces pain and odor, and serves as a microbial and fluid strike-through barrier, all at the same time, all in one dressing. Self-adaptive wound care technology turns current multiple dressing materials chaos into order. Medical professionals get efficient, guesswork-free patient visits, optimized and simplified workflow, decreased inventory, and patients get faster healing and better quality of life.